Hi, I'm Bryce Miler, and for the next hour, I'm going to be going over information about insurance coverage for ABA therapy. For the past 4 years, I've been the contracts director for the Center for Autism and Related Disorders, dealing with insurance companies and provider contracts since day one. And before that, for 24 years, I was the contracts manager at a major insurance company, writing medical insurance contracts for 24 years. I apologize for the size of the print on the PowerPoint that you're going to see. The big, bold bullet points that you normally see in PowerPoints really won't work for this because there's so much detail and so many complicated concepts that I feel that all the information is needed. So what we suggest is that you email us and ask us for a copy of the PowerPoint so you and your staff can go through it and learn all the information you need and take what you need from it. We're going to go over the information for the next hour, and then after that, we'll take 15 minutes worth of any questions that come through. So let's get started. We're going to be talking about insurance coverage for behavior analysts. I have to read this disclaimer, unfortunately. The following material is for informational purposes only and is not meant to be construed as legal advice. You must check with the insurance company or your legal consultant for verification of specific guidelines which may be required. Just a quick overview, we're going to go over insurance coverage for ABA therapy, a little bit of a history. I do think that's necessary so you can know why we are at where we are at with the companies and what they're doing with us. It's been a long road, and I know a lot of you out there probably have helped fight to get where we are. Also, insurance plans and benefits, basic information. I know if you're already dealing with insurance, you know some of this, but it never hurts to go over it. Participating as a network provider with insurance carriers, that can be difficult. Verifying benefits and getting services pre-authorized and filing claims. Just to go over what's happened in the past with ABA therapy, I was a contracts analyst with a major insurance company, and I can remember when I was writing these contracts that they used to have an exclusion. It was exclusion number 32, and every single plan we had. This is as recent as 1994. I'm older, so 1994 doesn't seem like that long ago to me. But as recently as 1994, our plans had exclusions, every one of them. Exclusion number 32 that said that no therapy, no anything, no services were covered if the diagnosis was autism. And the reason why the medical establishment did that was because they and the medical establishment, everybody, they believed that there was nothing that could be done to improve the condition of a person with autism. No medical services, no speech, no OT, nothing. So why would they cover something if they didn't feel that it would work or cause improvement for their patient? So, you know, as we all know, we've come such a long way, and everybody knows that there are many therapies that can greatly help people with autism and even can cause recovery. A little bit more history. I wasn't around in the 70s with the insurance company, but this is true fact. In the 70s, the insurance companies were rejecting claims for ABA therapy and, you know, any claims for the treatment of autism, basically saying that autism was a congenital defect. That was their party line. In the 80s, they were rejecting claims for autism because they felt that anything that they would be doing would be educational in nature and not medically necessary. In the 90s, most of the time they were rejecting claims because they said that, especially our claims, ABA therapy, that services were experimental or investigational. That means they're not proven effective or to have any effect. In the 2000s, and then even today, in most states where they're rejecting claims, the reason why they're rejecting them is because they say the plan just simply doesn't cover that kind of therapy. It doesn't have any benefits. So over the last 18 years, many states have mandated that carriers provide existing plan benefits for the diagnosis of autism. So there's parity laws in a lot of different states that they've passed, and California has one, New York has one. A lot of states have these parity laws that say that the carrier has to cover the diagnosis of autism the same as any other medical condition. A lot of states have, California has AB 88 that says that severe mental conditions, there's 10 that they list, have to be covered the same as any other disease of the brain. Well, when they did that, when they passed all these parity laws, and California was in 2000, so that's 12 years ago, when they passed those laws, they did have to cover anything, any type of therapy that was included in the plan, like speech therapy or OT, if the plan had that, but they did not have to cover this newer, not new, but this newer type of therapy called ABA therapy. So what we're left with in every state is that, yes, they may have a parity law that says that they have to treat autism the same as anything else, but it doesn't force them to cover the type of care that ABA is. Almost all medical plans, some don't, but most all do have coverage for mental health. And our ABA services and autism, most of the therapies fall in the mental health range. But the plans never covered something called ABA therapy because it hadn't been forced into the plans yet. They'll cover inpatient hospital care, outpatient care, and clinical visits to a psychologist, therapy visits. But this ABA thing, it was a new animal, and the carriers didn't know what it was and didn't want to deal with it. So today, we have 30 states that have passed laws mandating behavioral therapies, ABA therapy, for the treatment of autism. I'm going to go over really quickly on the next few pages the different states and some of the components of their laws. It's very important for you to know that each state, when they pass an insurance mandate, they have their own rules. Each state has their own entities, they have their own rules, they have their own ways of passing laws, and each law is written differently, and there's different rules about who has to provide the care, who can get the care. There's age limits, maximums. So the most important thing for you to take away from this is you have to know what the rules are or the mandate is in the state you're practicing in. So we have Arizona. I'm going to just mention a few of these, some of the maximums you'll see. Arizona has a $50,000 maximum up to age 9 and then 25 to age 16. California, our law goes into effect very soon, and that has no age or dollar limits, which is the best you could hope for. But it does have some restrictions. It doesn't cover California state employees, and that's a big problem. Connecticut, their law has been in effect for some time. Florida, Illinois, Indiana, Iowa, Kansas. Oh, and say Iowa. The way they wrote their law, the mandate only applied to state employee health plans. So if you're in Iowa and you don't work for the state of Iowa, you probably don't have any coverage. So you can see by the differences in these different mandates that I have on the PowerPoint here, you can see that each one is different, and each state gets their law passed however they can. We've got Kentucky, Louisiana, Maine, Massachusetts. Theirs has been in effect for a little while. They have no age or dollar maximums. That's a good one. But Montana, Nevada, New Hampshire, New Jersey, New Mexico, New York is coming up soon. They got $45,000 max on their mandate. Pennsylvania, Rhode Island, South Carolina, and Texas. Texas has been in effect for some time. Vermont, Virginia, West Virginia, and Wisconsin. Okay, some additional information about these mandates. In most states, in most cases where the state mandates coverage, plans, they can't add any special limits or dollar limit, or pay things differently than the rest of the plan. They can't do that for the autism diagnosis. Insurance carriers can require providers to submit treatment plans for prior approval, usually every 6 months. That's a good thing. You want pre-approval to make sure they're going to pay your claims. And under most of these laws, behavioral therapy coverage is required if medically necessary and provided or supervised by a licensed or certified provider. The way it's coming out now, most of the states are picking up on the BCBA requirement for supervision at least. And most of these state laws do not apply to the following types of medical plans. So not all plans are going to have to cover it. The plan that your patient is on may not have coverage at all, even if they're in a state that has a mandate. A lot of states don't require individual plans to cover it. California does, but many of the other ones, the mandate doesn't apply to a person that buys individual coverage off the street or it's not through their employer. Small group plans, I know Arizona, the mandate doesn't apply to small group employer plans, and those are plans that have 50 or fewer employees. That's the definition of a small group plan. Limited benefit coverage, that's when it's just a supplemental type thing. It's not full major medical. And then plans issued or underwritten in a state other than the one that has the law mandating the coverage. This gets really confusing because there's a lot of Blue Cross Blue Shield plans, and a person says, oh, I've got, Blue Cross of California. Well, they look at their card, they may not have Blue Cross of California or Anthem Blue Cross or Blue Shield or whatever. They may work for a company that is headquartered in another state and doesn't have a mandate. So it's important to find out where your plan is issued through, because if your plan is issued through, Utah, Blue Cross Blue Shield of Utah or something, just because you live in California doesn't mean you get the mandate that California requires, because your plan is issued out of a state without a mandate. Another important fact to know, and I put this in here right after the information about the state mandates, you saw that a lot of the states have dollar maximums, and what insurance company is going to just want to pay unlimited monies if they don't have to. So a lot of the states passed laws of $45,000 a year max. Some had $36,000 a year. Illinois has that. But what happened in 2009 is really important for you to be aware of, and your members as well, your clients as well. It's called the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act of 2008. Now, it took effect October 3, 2009, and what it does is it requires parity for mental health and substance abuse disorders, and it says that carriers cannot have a benefit or dollar maximum for a mental health diagnosis that isn't also applied to any other medical condition. So what this means, and we have tested this out many times and it's always been true, what this means is that the federal law, which always overrides state laws, if you have, Illinois, if you have your coverage in Illinois, that state mandate said there was a $36,000 maximum. Well, on or after 10/3/2009, the federal law dissolves that maximum, and technically, if you're in the right type of plan, they can't have that maximum anymore. It has to be taken away. So we've seen it happen many times. We've had to fight it many, many times, and in almost every case we won. The Federal Mental Health Parity Act only applies to large group employer plans that's 50 or more. So, it's not 100% that every plan that is mandated to cover it in each state will have to dissolve that or get rid of that dollar maximum, but a lot of them will. So it's important to just be aware of it. Coming up on important tip number 1, I was trying to change this up to reach all the BCBAs and give them something that could actually help them in the long run and be valuable. My biggest suggestion and thing that's helped us the most is to stay up to date with what's happening in your state by connecting to autismvotes.org, connecting to that website to get alerts sent to your email or cell phone about laws in your state or important changes. You go to their website, it's here. Another reason why you need to email us for the PDF of this PowerPoint, so you want to be able to get all this information out and use it. Autism Votes, they have weekly updates. They send these things to to your email or your phone. And there's so many things that they've sent us, and I always make sure and read them so I'm up to date. But without that, I don't know if we would be where we are today in covering all of our clients. So for example, on May 17th, we got an email from them and where we learned that TRICARE is the insurance coverage for active duty military people. They've had insurance coverage under their plan. It's called the Autism Demonstration Project. They've had coverage for 4 years now. So they were kind of a big trend in getting other people to cover it, but they're close to eliminating the $36,000 maximum they had. And the TRICARE plans are not subject to federal law, the law that I just talked about, where I said that the state mandate, the dollar maximums under the state mandates would kind of disappear because of that federal law. The feds and military, they can do whatever they want. So they did have this $36,000 maximum per year, which, if you think about it, that's really restrictive. If you have a kid that could really use a 40-hour program and do very well with it, $36,000 a year is about 11 hours a week. So it does need to be unlimited to get the kids to the full potential. But we heard that they're close to finalizing, eliminating the $36,000 maximum. It's not final yet. It has to go through another house. But, I think they're very hopeful. And allowing retired military staff to have coverage as well. Under the TRICARE, it's only active duty military folks that got the benefit. The retirees say, you fought in a war and you're out of the military, you could have young children. Those people didn't get any benefits at all. So that's amazing news for us. We were thrilled to hear that, and we got that from Autism Votes. And then on May 31st, another huge piece of information. The federal employees, it's a federal government plan. They don't have to follow state mandates either. It's not regulated by the state insurance commission or what have you. It's the feds. They have their own rules. Federal employees, I've never seen one. I haven't checked somebody in every state, but I've never seen a federal employee under those plans that actually had coverage for ABA therapy. They've never been required to do it. They don't have to comply with state mandates. If the state the employee lives in has a mandate, they don't have to do that. So we learned on the 31st that the federal employees, they're going to add the benefit, I think, for everybody throughout the country on January 2013. So that's great news. Important tip number 2 is if your state does have a mandate, you need to read the law, the actual insurance mandate as written in the law, and understand exactly what insurance carriers are required to do. It can be intimidating at first. They're kind of hard to read if you actually get the printed finalized law. But if you read through it a few times, you'll be better able to understand what is required. And if you're not 100% sure about what the law says, you can contact your state's chapter of Autism Votes. Each state, as far as I know, has a state chapter of Autism Votes, and they can help you with questions. They have been, I know a lot about insurance, I know a lot about autism, a lot about mandates, but there's been several times when I read the law, and what I used to do as a contracts writer for in my 24 years, I used to get the laws as they were passed and have to rewrite the evidence of coverage booklets, the benefit booklets for the members. So I know what those laws say and I know what they mean. But there have been times when I wasn't sure either. So I've emailed the people at the state chapter at Autism Votes to try to get clarification. And they were so helpful. But for example, we had a case in Texas where the Texas law, it has an age limit. It has an age limit, and it says that, coverage will only be mandated up to age 10. But when you read the law, it actually says in it that if a child is in treatment and, is obviously doing well or progressing, if the child's in treatment before they turn age 10, that the plan or the carrier should continue coverage, okay? So when we saw that, we had one of our clients that was going to get terminated by the insurance at age 10. So we brought that up to the carrier, and they followed the law and continued coverage because we could prove that the service was beneficial. Another thing to remember is Obamacare is coming down the pike, as long as it's not overturned or changed, in 2014. The federal health insurance reform bill, which is called Obamacare, was signed a few years ago, 2010, and that should require all plans to cover ABA therapy as written at this point. This slide, of course, is too little for you to read, but this is kind of an explanation of how it should work. Each state has to have an exchange plan, and those exchange plans under Obamacare are plans where that an uninsured person or a person that can't get coverage through another carrier, they can go and hook up to the state plan and get themselves coverage to stop from getting the penalties. You know, I've heard about the penalties if you don't buy insurance. They could, charge you $800 on your taxes or what have you. They're going to fine you for not having insurance. Well, these exchange plans are what they're going to set up for people that need that insurance. And those exchange plans, in order to qualify for a plan that qualifies for, you know, not getting the penalty against you, or a plan that is technically viable insurance under the rules, the exchange plans, in them, they're going to require coverage for behavioral health treatments. It's in the law right now, and we verified that behavioral health treatments includes ABA therapy for autism. So what's going to happen is all these self-funded plans. There's a lot of self-funded plans that do not have to follow the mandates or cover anything. For those plans, in order for the employees to be able to have a viable plan that qualifies as a full medical plan under the rules, it's going to have to cover a bare minimum of what's under these exchange plans. And that would mean that all of these self-funded plans and these employer plans, they're all going to have to cover ABA therapy, because they've got to come up to the minimum level of benefits that these exchange plans have. It's kind of complicated. I hope that wasn't too confusing, but that's basically, in a nutshell, what we think is going to happen. Okay, now I'm going to go over how different types of plans work and helping your patients verify coverage. So the question is, does their plan have any benefits for ABA therapy? If there's employer-sponsored health coverage, parents need to ask their human resources contact to tell them if any of the health plan choices they have include any ABA benefits. The employer has to get an answer for them. When you have insurance through your employer, that's part of your compensation. You're buying something. So when you want to find out what's in this plan, if it covers ABA or not, they have to tell you what you're buying. So they do have to give you an answer about what you're going to get for your contribution. Of course, people should always get information in writing if they can, and get the name of whoever's giving them information. Next, we have HMO and POS plans. Those plans require members to choose primary care doctor. And for HMO plans, all care must be provided or authorized by the primary care doctor or the insurance company. And then we have POS plans. Those are great plans. There are not too many of them left, I don't think, but those plans have an HMO component where you sign up with a medical group, and then they have a PPO side where you can go away from the medical group and use one of their network providers and also go out of network. Okay, PPO plans. If they have a PPO plan, those plans, they have networks of providers who agree to negotiated rates, and they do pay greater benefits if their member uses a participating or in-network provider, but members can still see any out-of-network if they want to. They'll get dinged and less will be covered, but those plans usually pay 80 to 100% for in-network participating providers and 50 to 70% for out-of-network providers. And almost all PPO plans have a calendar year deductible. Next, mental health carve-out carriers. This is one of the most confusing things, I think, in the beginning when somebody's trying to work with insurance, is that some of the bigger companies, they'll have one company that they hire to do all their medical claims. But then they may have a whole different company that they hire to handle their mental health. And our types of services, the ABA normally is considered a mental health benefit or paid under those kinds of networks and those kind of benefits. So what they do is they carve out the mental health administration or the administration of the mental health benefits to another carrier. So be aware that you may have an ID card from somebody that says Aetna on it, but then when you figure out where you're calling to check on mental health claims, they may have Cigna handling their mental health benefits. The ABA provider can check into participation with the carrier if the plan actually has benefits for ABA therapy. If you agree to participate with a carrier, you may have to agree to a single case agreement or full participation. You'll need to determine benefits as far as deductibles and co-pays and any maximums. So bottom line is, if your patient actually has benefits, you're going to need to decide if you're going to deal with the insurance company and bill for the family if you're not participating with the carrier, or if the carrier, you may not be able to participate with the carrier because they may not have a network. They may not be signing people, ABA therapy providers up to be in network. They may not be doing that. So if they don't do that, they may give you a single case agreement, and a single case agreement is something that they give you just for the single person, just to be able to bill and get authorizations for one single patient. Many carriers are having a tough time getting a coverage situated for their members, so until they can contract with a full network of ABA therapists, they do enter into these single case agreements. You will be issued an agreement with approved services, and you will need to negotiate rates and services. Be careful with the rates. Some carriers are doing things that, I think they know the rates are low, but they're trying to get anybody that will, any provider that will, to agree to them. I have a little information coming up about some of the rates, but and if a person has coverage, you need to know that the carrier has to provide access to care. This is one of the hot button items right now, because if a person if they're subject to the mandate, the carrier has to cover ABA therapy. They have a benefit. It's in their contract that they have to cover it. They have to provide the person access to care. Okay? So a lot of them have no network. They've just started creating a network. So they can't tell the patient that they have to use a participating provider when there may be just one in, a 100-mile radius or none. So if they don't have a network of participating providers close enough to that family, and keep in mind, ABA therapy, you've got to be doing this every day, so you can't have to drive a kid 45 miles one way and then back every day. They can't require that, but they will have to arrange, if they don't have an appropriate network or appropriate provider for you to use, they will have to arrange for you to be able to use an out-of-network provider, and they can't penalize the claims, meaning they can't pay the claims at the lower out-of-network percentage or amount when they don't have a person for you to use. They absolutely cannot do that. So if the person has an HMO plan or PPO, whatever, and they've got the benefits, and the carrier does not have an adequate network, and keep in mind, just one provider for the greater metropolitan area, that's not going to do it, and that provider may be full. So if that's the case, they're going to have to make arrangements to pay for out-of-network providers. There's a lot of carriers we've dealt with that they had the law for 4 years and they still didn't have a network after 4 years of participating providers because they kind of just didn't want to deal with it. You do want to be participating with the carriers as much as possible, because we find that your claims will get paid much easier if you're in network. And it's also better for the patients because you'll bill for them and then bill in their co-pays. But the carriers do have to pay appropriate claims within a reasonable time frame. And if you're a participating provider, if you do, participate or have a single case agreement with the carrier, You'll have to, you will bill the family for any co-pays or deductibles, and that's usually after the insurance company pays you whatever they should pay. So you're going to have to bill the insurance company, wait for them to pay you. You actually don't have to wait, but it's kind of difficult to know what they're going to pay you until they do. So, you'll bill the insurance company, and then you'll bill the family for the co-pays later on. And also remember that in most cases, insurance should always pay first. There's all sorts of state programs that are out there that consider themselves payer of last resort. So when the person actually has employer-sponsored insurance or even individual, that plan is always should pay first, and then anything else would be secondary if it's a state program or Medicaid or what have you. If they do have coverage for ABA therapy, do they have any out-of-pocket costs? The answer is yes. Almost always, and this is another big topic for people in certain states because, say in California, we have a system where we have regional centers that have been doing ABA therapy, and it's a state-funded program, so there's no cost to the family. Well, now that they've got insurance, they're going to have deductibles, they're going to have co-pays, they could have co-insurance where they have to pay 20% of the bill, and everybody knows that that is very expensive, especially if you have a full program. It can be excessive. Even the plans, the HMO plans that may charge $25 per day, you're going 6 days a week, that's a lot of money every month. And it's so tough out there. I just can't think of too many families that can come up with an extra $600 a month. I can't. So this is a difficult it's a difficult thing to have to afford, and a lot of the plans are getting worse and worse every year. Higher deductibles, more patient responsibility. But one thing that you need to keep sight of and always ask for when you're checking benefits is what the out-of-pocket maximum is. A lot of plans, most all plans actually, have an out-of-pocket maximum. And think about it, if you had open heart surgery and you were in the hospital for 6 months and your bill was $500,000 and your plan paid 80%. Well, that $500,000, they paid 80%. That means you pay $100,000. People could lose everything if they had that kind of debt. So most plans have an out-of-pocket maximum, and the purpose of that is to cap your losses. It's to stop it from going to a catastrophic level where you lose everything. So a lot of plans will have a $2,000 out-of-pocket maximum, or $5,000, or $6,000, even $10,000, to where once the cost that the family or the patient has to pay every year, once that hits the out-of-pocket maximum, say $5,000, then the plan starts paying at 100% for the rest of the year. So your out-of-pocket your out-of-pocket costs are capped to where you don't lose your house or everything you have. It's still difficult to come up with $5,000 a year, but it can be budgeted, and it can be doable for some families. If you are a participating provider, you must bill the insurance for the client and then bill them for any co-pays or deductibles. So that's another thing. You can't require the family to pay up front or anything if you're having trouble with the insurance company. If you're not a participating provider, then in most cases, in a lot of states, the carrier may not be able to pay you directly. So unless you're a par provider with that carrier, they may not be able to send you a check. I mean, you could be nice and try to send in a bill for the family, but they may not be legally allowed to send you a check for that person unless you're in their network. So you got to be careful of that. I think most providers, if they're not in network, they may make the family pay the bill every month, then release an insurance-ready invoice to them so that they could try to get their money back. And like I said, that's difficult because instead of having to come up with their copay, now they have to come up with a whole bill every month. Then they have to fight it out. It's going to be harder because you're not in network with them and such. But anyway, and another important note regarding access to care. If you and your staff are looking at this, I'd pay close attention to the access to care issues, because you can fight and win these every time. If the plan has benefits for ABA therapy, no matter what type of plan they have, and the carrier doesn't have a participating ABA provider in their area or enough of them to choose from, they will have to refer them to a non-par provider and pay benefits at the highest level. If the plan has no benefits for ABA therapy, what can they do to change this? This is an important one because we've had many families throughout the country for the last 4 years where they went to their HR department. We advised them. I think Autism Votes has some information on. They do have some job aids or information on what families should do. They went to their HR departments and said, "Why doesn't my plan cover this? We need this." You know, there's several families that work for the city or whatever, and we deserve to have this covered for our kids. And they considered it, and in I think it's 6 cases we had, they decided that at the next plan change, you know, they can't change it in the middle of the plan year, but the next plan change, they decided to add the benefit. So families can go to their HR department and plead for them to cover it. In a lot of states where the mandates are, you know, self-funded plans. Self-funded plans are plans that they pay their own claims. Technically, the mandates in the 30 states, they apply to insurance. It's an insurance mandate. So if it applies to an insurance type policy, that's one thing. But self-funded employer plans, they're not insurance, because the employer, say it's UPS or whoever, these giant insurance companies, they have decided to self-fund their own claims. The money for the claims that their employees incur, the money comes from their bank account. It's not insurance where they just pay a certain amount per month per head. So since it's not insurance, it's not regulated by the state regulators. It's subject to rules under federal law called ERISA. And since they don't have to follow the state laws, they can say, we're not going to cover ABA therapy at all, even if they have a mandate. So a lot of the people that actually were successful went to the Human Resources Department and said, you know, we have a self-funded plan. You guys can really cover whatever you want. And the thing with the mandates, too, on self-funded plans don't have to follow these mandates, but they can if they want to. They're self-funded. It means they can kind of cover whatever they want. So a lot of larger self-funded plans here in California, Silicon Valley, they started adding the benefit before anybody else because they saw the need in their employees. We have Intel, Yahoo, eBay, Time Warner, Cisco, Wells Fargo, State Farm, Microsoft. They have a great plan. NVIDIA is a computer software company, I think. And also, you know, I said the Department of Defense, they've had a $36,000 maximum benefit for over 4 years. If the plan has no benefits, can they send in claims and try to fight a rejection? Yes, they can. A lot of people have been able to win those. They can, any person can look in their evidence of coverage booklet, or if it might be called a SPD summary plan description. They can look in their book, and by law, their benefit plans, they have to tell them what is covered, what isn't covered, and how to file a grievance. If their claim gets rejected or it's not paid as they think it should be, every state has a law that says you have to tell a person how to file a grievance, how to file a complaint. Okay, so the family could get their book out, and you know, if they're going to try to fight the insurance company to get them to pay it, they should take every page out and have it in a little manual or something, you know. But the rejections too. The rejections, like say if they sent in a claim and it got rejected, those rejections, usually on the back or whatever, it'll tell them how to file an appeal. A lot of states, most states actually, they have an appeal process at the end of the final road to fighting, which is called an IMR, Independent Medical Review. And that's where they take the situation and put it before an impartial panel of professionals trained in the domain or ABA or whatever. So a lot of people, when they get to that final step, the IMR, that's where the denials are getting overturned and the insurance companies are forced to start covering their claims. Next, I talk about how PPO plans are a little bit different than HMO if you're fighting. PPO plans, it's harder because in order to get a rejection out of a PPO plan, you've got to incur claims and send in a claim. So you have to have a bill. You have to have, you know, a certain amount of dollars rendered from a provider. So the person has to pay the claim up front. The member would have to pay you for a certain amount of time. You give them a bill, and then they can send it in and see what happens. Once the claim gets rejected, Then they follow the appeal and grievance processes, and then they can fight until maybe the carrier will overturn it and say you should be covering this. But HMO plans are a little bit better because with HMO, you don't have to send in a claim to get them to start reviewing your need for care. You can go to your medical group or the HMO carrier and say, I want a referral for ABA therapy for the treatment of autism. And if they don't approve your referral, you'd say, I want a referral to provider XYZ because I need ABA therapy. Well, if the plan doesn't have any benefits, they may reject that referral, but on the rejection, it'll tell them how to file an appeal. So HMOs, you don't have to start therapy and do it for a couple of months and get all your claims put in. You don't have to do that. You can just ask for the referral up front. And many major national insurance carriers are contracting with ABA providers to provide therapy for their members. And you'll see the national companies are far more ahead of like some of the blue plans in certain states because they have had members in states with mandates for some time. I mean, if you have Aetna or Cigna, TRICARE, HealthNet, Magellan, United Health, a lot of those carriers, they've been dealing with these mandates for a long time because they have people all over the country. Many of the blue plans, some are really good. Some do a really good job. Some are very difficult to deal with, especially if they're starting with it. But like I said, the national companies, they're better at. They have a network. They have people. The hardest thing in the world is when you're trying to get a pre-certification or check on benefits and the carrier doesn't have a dedicated unit or team of people that know about autism. When that happens, it can be the most frustrating thing in the world because you get customer service rep in Panama or wherever they're sitting and they know nothing about anything. So until you can get to somebody that knows about what's going on, it can be very difficult. Participating with carriers, how it helps and how it helps your clients and how it could hurt if you don't. This is pretty obvious, but many more clients can access urgently needed care if you're participating because they can afford to do it. That's a no-brainer. Payments will be reimbursed at the highest payment percentage if you're participating with your client's carrier. The burden of dealing with insurance claim is lifted off the parent's shoulders. True, but then it kind of goes on your shoulder. You can negotiate set rates with the carrier. That's true. Families can afford more extensive comprehensive programs, so the kids can actually get all the hours they need, perhaps. Carriers that issue prior authorizations are basically issuing a guarantee to pay claims. It really isn't a guarantee. Some states it is, but it's pretty solid. If they give you a pre-authorization, you can really fight a long way if they all of a sudden say they don't want to cover it. Then insurance carriers will pay you directly. If you do not participate, they usually can't pay you directly. And then on the flip side, how it hurts your clients, if you don't participate, they'll have to come up with all the money up front, and then they'll have to fight the carrier. If it's an HMO in a certain area may say, yeah, we have enough ABA providers. They might not be able to use you at all. Because they might say, yes, we have enough of these providers. I haven't seen very many cases where any area has a full network of ABA providers in their PPO network or their HMO network. They're still working on it. I mean, the first couple of years that a lot of these states had their mandates, they had to pay the claims, and they were begrudgingly, they were paying the claims. You had to fight every single claim that got rejected, paid wrong every single time. Then, maybe after about 6 months or a year, they would hire dedicated people who get a little bit better. And, gradually it got better because they were getting complaints filed against them with the departments of insurance. But anyway, I can't think of too many that actually have full networks. So years are going by. If they do have a full network of HMO providers, then they could say you can't use that provider. The benefits will be paid at a higher amount. It'll be paid at the in-network level for PPO plans. And next, we've got some things to consider if you're deciding to become an in-network provider or participating with the carrier. You might need additional staff to verify benefits, submit claims, and take out pre-authorizations. Some carriers take up to 30 days to pay claims or more. But if you submit claims electronically, and we suggest that whenever it's available, some carriers don't have the setup for you to send your claims in electronically and hook up that way. If they do, you should do it. It can be amazing. They'll pay you in 2 days. But like I said, it's not always available. The rates they offer may be less than your normal charge. That is true in a lot of cases. Hopefully it's not too much less, but it can be frustrating. Asking for claims adjustments for incorrectly paid claims and dealing with customer service, that's an understatement. The biggest understatement I've ever made is that it can be frustrating. It's very frustrating. You'll have to bill the insurance and then balance bill the client for any copays or deductibles. That's a double step there. You may have to keep track of payments for plans that have a calendar year dollar maximum. Say if for whatever reason the plan does have $36,000 max a year, you want to make sure that that dollar maximum doesn't wear out and get used up before the end of the year and leave the child with 3 months worth of no services until the maximum gets restored the next year. Next, I have some information about some of what some carriers require for qualifications, like who is allowed to participate with these carriers, who has to supervise. Like I said, most of the time it's a BCBA, but each carrier has different rules. So these slides, I'm going to go through this really quickly, but they if you get a copy of the PowerPoint, you can take a look at that. Each carrier will have slightly different rules about who can be considered a paraprofessional and paid for the one-on-one therapy, who has to supervise, what credentials you have to send in. So each one has their own rules. One of the slides here talks about mental health networks, and then we have Magellan. Magellan is a mental health carve-out carrier that has been covering up ABA therapy for some time. I believe they have a lot of national accounts. The rates of reimbursement. This is hot button item number 7 here because a lot of ABA providers are having big problems with carriers trying to get them to accept really, really low rates. I've heard stories where they're asking them to accept rates that are far lower than what they're paying their people. There's no way it can be done. So one thing I've always tried to stick with, and it can be difficult in certain areas because you need to charge more than this, but TRICARE, the active duty military plans for the TRICARE people, their rates are published on federal regulations. They publish these rates. It's written into the law, and anybody can get this by Googling it. You could just TRICARE, autism demonstration rates. The rates are in there, so I can publish this and tell you about it. But they pay $50 per hour throughout the country for one-on-one therapy and $125 for supervision. A lot of carriers are also issuing blended rates that could be like $55 across the board for supervision and therapy. But one thing I try to do is, if I'm negotiating with a carrier, I try to make sure they know that, let's not go below what, the TRICARE plan covers. Let's try to stick at least with that, because we know that the federal government thinks that that's a fair rate, and I'm sure it's lower than what we probably should be charging, but let's try not to go below that. Next, how do I become approved by the carrier? Each carrier has different rules. When you get the PDF of this, you're going to read this, and hopefully it will help you a little bit, but you need to contact the carrier. Usually they have a website. It can be frustrating. You go to the website and it says how to become a participating provider. It can be a lot of work. It can take a little while just to find out what you need. And sometimes the websites, they don't have information about ABA therapy. So if you've got anybody that has talked to a carrier and they have any contacts at all, I would take that information and get the information from them, because what you want to do is talk to the carrier and find out what the first thing, most important thing is what rates are they going to pay you? Can you agree to the rates at all? So that's the first step. And then, after that, they'll have an application process. They may make you sign up with something called CAQH, which takes a couple hours to get all your information in there, and then all the carriers will be able to go in and look at it. It's a great idea to do it, but the frustrating thing about that was until right now, they didn't even have a category for BCBAs to put your information in. What CAQH is, it's kind of a portal where all the insurance companies can hook up for doctors and therapists and all that. They can hook up to this portal, and you put your resume and all your updated licenses in there so that you don't have to send every carrier in your area all this personal information about yourself. They can hook up to this thing that you update whenever it needs to be, and they can go and look and see your credentials. Other than that, you fill out applications or what have you. So just until recently, they didn't even have a category for BCBAs, so it's been very frustrating. They'll usually ask for a W-9, other things. You know, you're in proof of insurance. They usually want the $1 million, $3 million liability. And the application process can take 6 months. So it's not going to happen overnight. Now, once you become a participating provider, it's best to sign up to submit claims electronically. If you can, do it. Find a way, get some staff to figure it out, write instructions for yourself and do it. You need to keep detailed records of the different departments that you're talking to. There's going to be a pre-authorization department, a claims department, you know, all sorts of different departments. So you want to keep info sheets or something on each carrier about who you're talking to. You need to keep track of the rates with each carrier, because each one, they may negotiate a different rate with you, and you are only allowed to bill at that rate that you've negotiated with them. So you have to keep track of that. You need to keep accurate records of employee qualifications, trainings, services, anything that they require, because they could audit you. And if you say, yes, my paraprofessionals, they all have 40 hours of training, and they've got this, and they've all got at least a high school diploma or whatever they have, or, you know, maybe they require hours of experience or something, you need to keep those records, because if you get audited, you're going to have to prove that those people qualify, and in your contract, you're agreeing that your paraprofessional staff or whoever is going to have these qualifications. They're not going to usually make you send that information in, but they're expecting you, when you sign the contract, that you said, yes, my people will have this. They better have it. Next, verifying benefits, pre-authorized, getting services pre-authorized and filing claims. If you're a participating provider with a carrier, you must verify benefits before agreeing to services. You'll have to call the provider number on the ID card. It's very difficult to get a straight answer many times about whether they cover ABA. You'll call and they'll say, we need to know if ABA is covered. They'll say, yes, autism is covered. Autism is covered is not the question. Almost all plans will cover the diagnosis of autism. The question is ABA therapy for the treatment of autism covered? And you need to keep asking that question, because many plans cover counseling, but you need the answer on, are they covering ABA therapy? Your office staff should always get a copy of the client's cards. The carriers won't talk to you unless you have certain pieces of information. So you're also going to need an assignment of benefits. You can get that, you know, you can search the web and get a sample of that if you need to. But assignment of benefits, in order to bill an insurance company and have them pay you directly, you have to have the insured assign the benefits to you. So there's a special form where they sign, and it says that they are agreeing to have the carrier pay their benefits, that this plan is theirs, pay their benefits to you, the provider. Next, I just have kind of a checklist that you may want to you know, work up or start with. This page, you know, has many of the pieces of information you would want to set up on an info sheet, so that you could get yourself ready to be able to talk to a carrier about someone's coverage. And getting services pre-authorized. If you're participating with a carrier, they'll tell you how you go about doing that, but in order to do that, you'd call the number on the back of the card and ask if they will pre-authorize services. The bummer is that sometimes carriers won't pre-authorize services. They won't. Their system doesn't require it, and you can't make them. If they say, we don't require pre-authorization, send in your claims, that's not good, because you really do, even though it can be a hassle, you do want them to pre-authorize your services, because you've got a paper saying that for the next 6 months, we are approving, you know, 100 hours a month of therapy, 8 hours a month of supervision, And with that paper, you feel much more confident that they'll actually pay your claims. And if they reject them, you have something to show that this was already reviewed. You already said that this is approved and you have to pay it. And in most cases, they will. Continued authorizations, once you get the first authorization, if it's required, they usually require reports with goals and progress included. So writing reports, of course, you know, that has to get done in most cases, but most carriers require that you send the updated report in within 15 days before the expiration of the last authorization. So if the authorization is going to expire on 7/1, you'd want to make sure you had your report ready by 6/15. Let's see. Now, we have some information here about filing claims. These are just some websites that will help you get the claim forms. There's special forms. Almost everybody uses something called a CMS 1500 claim form. And this website that I put in here that you'd be able to get if you emailed and asked for the PowerPoint, the website, it has an amazing thing. And I was familiar with claims when I first started doing this, but I printed it out and it was fabulous. There's fields. It's just the CMS 1500 is a one-page form, but there's 35 fields there, and the website has an information box on each field and what it means. So I think anybody, if they had that, they could be successful doing claim forms, even if they didn't have any training. You should complete as much of the claim form as possible. Carriers are notorious for sending back claims for what seems to be obvious mistakes. If you have a written authorization, you should, there's a box that you can write the authorization number, put that in there, or attach it. And appealing short payment or rejection. My advice on that is it does happen all the time. Even if you have an authorization, they pay claims wrong every day, all the time. It's insurance. That's just, I don't know why, but it happens. So my suggestion is when you get the explanation of benefits, you need to check it as soon as possible and make sure they paid what the people that verified the benefits with you. When you call to verify benefits, you're going to ask them, is there a deductible? What is the copay? How much? Is it $25 per day? Is it 10%? When you get the explanation of benefits, you need to verify that they paid it the way they were supposed to. And if they didn't, you need to call the phone number on the explanation of benefits, a thing that says what they paid. You need to call them and say, this was paid incorrectly, I want an adjustment. And, they're used to it. They get calls every day. They know that claims don't get paid correctly all the time. But my suggestion is you need to do it as soon as possible, because the more time goes by, it seems like the less likely that they'll actually fix it and pay your claim in a timely manner. Procedure codes, this is a big one. Up to right now, there's no 100% accurate code for ABA therapy. The AMA is working on that right now. It should come out in the next version of the CPT code in the manual books, but right now we don't have one. So we're using other codes that equal behavioral therapy, such as 96152 for one-on-one therapy and 96151 for supervision. So, each carrier is probably going to have their own rules as far as we mandate that you bill with this code or that code. And as long as it's basically correct for what you're doing, there's nothing wrong with that. We have HCPCS codes. That's another type of code that carriers use. TRICARE uses H2019. A lot of carriers use that as well for therapy, and S5108 for supervision. ICD-9 codes, every type of diagnosis, every condition that you could possibly have has a diagnosis code. And on claim forms, they want this ICD-9, the diagnosis code, to tell the carrier what condition the person is being seen for. And for autism, the code is 299.00. Asperger's and PDD are 299.80. And that does have to be on every claim. Next, I have some websites that are good to look at. So there's a TRICARE website. It'll help you become covered under the Autism Demonstration Project. And below that, we have some billing and claims filing help websites that you should look at if you're going to get into insurance billing. And in the end, many states are close to bankruptcy. It'll be even harder for state agencies and schools to provide funding for behavioral therapies. So we have the 30 states that have the mandates, and we need the rest of the states to come along. By that time, hopefully Obamacare will still be intact, and everybody will have coverage for ABA therapy without any maximums. By the way, Obamacare, the requirement, there's no maximum, no age limit. I think we're going to wrap it up. But go ahead and email us, and we'll send you the answers if you have any other questions, okay? Go ahead and send us an email, and then email us for the PowerPoint if you want to be able to look at all that language that was over my shoulder there. Thank you, and I really appreciate your attention.